Hello, my name is Dr. Shibunya, and I will be giving a talk about breast elastography. Elastography is an imaging technique that depicts tissue stiffness by means of imaging tissue strain from external compression. A software technique integrated into the ultrasound system without any external equipment is utilized. Same probe is used for the B-mode and elastography ultrasound imaging. The elastographic information is obtained in real time, and it only takes a few minutes, anywhere from 2 to 5 minutes. Based on a principle which is similar to palpation, that's what elastography technique is all about. On physical exam, as you know, tumors feel much harder than the surrounding tissue. With compression or vibration, when it is applied to the soft tissues, ultrasound then can be used to create a map of soft tissue deformation. The results are displayed on an image called elastogram. The elastogram generates a display of relative stiffness of the lesion to the rest of the image on a color image. And the main colors that you will be seeing are blue, red, and green. Blue will represent stiff lesions, red and green represent soft lesions. It is important to have the surrounding tissue included in the image, and we will be using a scoring system which was developed by Dr. Ueno from Japan. This is a diagram of all the scoring from 1 through 5. I will be going over each one separately. This is just to give you an overview. And as you go from 1 through 5, the 1 represents the benign lesions and the 5 represents the malignant lesions in progression. The green represents the greater strain. That's why it is soft and it looks green on the images. And the blue represents a smaller strain, and it is represents a hard lesion. The real-time elastogram is superimposed in color on the B-scan using a freehand scanning technique, and both are seen on the monitor with the B-mode on the right and the elastogram on the left. This is an example of an elastogram of a simple or complicated cyst, and it has a specific appearance of a 3-layer pattern where you can appreciate the blue, the green, and the red. So this is fairly specific for a cystic structure, and we all recognize it as such. The compression, when is being applied, is very important that it is applied in a very light touch. I refer to it as a feather touch. You need to use a lot of gel. There has to be a steady compression, and the compression of normal tissue is necessary to obtain the uniform image of the green. Then the area of pathology is then investigated using the same compression. This is an example of a breast tissue, normal breast tissue. This is the skin, and this is a fairly glandular, dense tissue. And on elastogram, you can appreciate mostly the green and the reds, which imply that this is a fairly soft area or normal breast tissue. On a elastic score of 1, you will see an even strain over the whole lesion, which is green, as well as the surrounding breast parenchyma. This would be an example of a fibroadenoma. Another example of a benign lesion, which is seen on an elastogram, would be a typical hypercoagulabulated lesion, which is parallel to the skin. However, when you apply the elasticity, you notice that the lesion is all green, and it is surrounded by fairly soft parenchyma, which is red or green, and this is a fibroadenoma. This is an example of real-time scanning with elastography, where you are applying pressure to this very light pressure, and you notice that the actual lesion and the surrounding tissues sort of blend in together. They all are either green or red, which implies that they are soft, not stiff. And on the gray scale image, this corresponds to a lobulated lesion, and this was a fibroadenoma, and this would be given an elasticity score of 1. The elastic score 2 demonstrates strain over the most of the lesion, with some areas being spared, and they are shown as mixed green and blue. It is normally seen with fibroadenoma or complex cyst. However, I would like to show you this particular lesion with the real-time clip, again demonstrating that when you do the actual compression, which are fairly light, in this case it shows both blue and green areas, which would be typical of an elastic score number 2. However, if you evaluate the actual B-mode image, you notice that this is not a very lobulated lesion, but it is lobulated actually, but it does have some areas of angular margins, and it does have posterior shadowing, so that would be more suspicious for a malignancy and probably a score of 4B or 4C. And this turned out to be a invasive ductal carcinoma after performing a biopsy. So the point of this case is that for final assessment for lesions, you need to do both the grayscale imaging and the elastogram as a single package, and then decide based on the worst characteristics, which are we dealing with a benign or malignant lesion. And as with using the BI-RADS system for any kind of lesion, you always go with the most worrisome finding, and in this case would be more of the angular margins and the posterior shadowing as shown. For elastic score number 3, the strain is at the periphery of the lesion, where it's mostly green and the central portion is blue. This is often seen with intraductal papilloma. I am showing you actually a case of a fibroadenoma where you have centrally stiffness of image with blue color, and then around it there is the green, and then surrounded by red. So this was a fibroadenoma. Elastic score number 4 has no strain over the entire lesion. It's completely blue, but it is surrounded by the green normal parenchyma. And this is always seen with most of the time seen with carcinoma. This is an example of a 39-year-old woman with invasive ductal cancer. And on the B scan, you can appreciate a lesion that is irregular, has angular margins, has some posterior shadowing, and on the elastogram, you appreciate that the lesion corresponds to a blue area, and it is surrounded by benign parenchyma, which is green and red. Another lesion which would be difficult to distinguish on B scanning itself, because it's hypoechoic, fairly well circumscribed, but has posterior enhancement, and this could represent a complex cyst, but we cannot exclude a solid lesion, so we would definitely biopsy this, but with the help of elastogram, we are seeing that this is all blue, which would be consistent with score 4, and it's very suspicious for malignancy, and this was, after biopsy, a lobular carcinoma.